We're going to open with Congressman Krishnamoorthi is going to be delivering some opening remarks. Then we're going to hear briefly from each of our panelists for sort of a 1-minute opening statement. From there, we're going to be turning to your questions. Because we're short on time and want to be moving quickly, we're going to have answer limits of just 2 minutes for our panelists. I know it's tight, but it'll keep things moving. I'm going to have a timer that goes out after those 2 minutes. And as for awareness, I'm going to be waving this tacky-looking white flag at the 30-second mark. So I apologize when I have something more elegant, but just for awareness, as we keep going, we're going to be doing that. For our viewers at home, there's a Q&A button that you can see at the bottom of the control panel in your Zoom window. If you go to the Q&A section, you can submit questions there. So we'll be pulling the questions from there and sharing them with the Congressman and our panelists. Congressman Krishnamoorthi, would you like to open with a few remarks?
Hey, thanks, Will. Thank you to everybody for joining, and thank you to all these excellent panelists for joining us as well. I'm going to keep my remarks very brief. Well, look, folks, I've been looking forward to talking about this issue for some time now because the youth mental health crisis is something that is in part a legacy of the COVID pandemic. It existed before, but now it is something that cannot be ignored any longer. I'll just share 3 statistics with you that have stayed with me that illustrate the extent of this youth mental health crisis. Almost 7% of our youth have substance use disorders. More than 30% more youth now report feelings of depression and anxiety compared to before the pandemic. And then the third statistic that I'll relate is the most shocking of all, which is that 20% of Illinois high school students reported seriously contemplating suicide in the last couple of years. And so this is shocking, but that is the state of affairs. And, during the pandemic, we all, regardless of age, felt isolated, were kind of very concerned about people's health, our own health, our family members' health. We're afflicted in different ways. And but our children, I think, in some ways, were most affected. And in my own family, my second son, we have 3 children, and my middle guy went through some really tough times during the pandemic, being isolated the way he was. Fortunately for us, he was able to bounce back upon returning to school. But for so many of our children, that's not necessarily the case. And they still live with some of the ailments that attended the pandemic. I would like to now turn it to our panelists to talk to us more about these issues. We have an excellent panel. Let me first introduce Dr. Jay Joshi, who's a physician. He's a board-certified anesthesiologist, and he's the director of the Altruistic Wellness Foundation. And he does a lot of work also in substance abuse and substance abuse disorders. The second person I'd like to introduce is Grace Hong Duffin, the CEO of the Kenneth Young Center. And Grace has been doing yeoman's work on mental health and substance abuse issues in our area, especially related to the LGBTQ community. And we look forward to hearing from her. Next is Dr. Rekha Kasi. She is a professor of psychiatry at Rush University. And she completed her fellowship in child and adolescent psychiatry. So perfect subjects for what we're talking about today. And then finally, Dr. Mashana Smith from the Center for Childhood Resilience. She is currently a professor at Northwestern in their School of Medicine. And she's also a mental health consultant with Lurie Children's. So I'm so grateful for all of you taking precious time out. And now I'd like to turn it to Dr. Joshi first, and then Grace, and then Dr. Rekha Kasi, and then Dr. Smith for your preliminary 1-minute remarks. So thank you so much.
Thank you, Congressman Krishnamoorthi, for first of all, inviting me and inviting all of us to this panel and being part of a very important topic. And, mental health has been something that we've been treating personally as a physician for close to 2 decades. And the intersection between mental health and physical health is inextricable. And the reason is simply because of the mechanism of action of how the brain processes pain and processes emotions. They're completely inextricably linked to each other. During the pandemic, we all know, just so the data says it, but we all lived it. We all know that everyone's a little more angry, a little more frustrated, a little more unsure about their future. Now, for those that are older, us older people, right, in our 40s and 50s and 60s, most of us at least had a direction in life, but our kids do not have that direction. And so at a young age, they've been exposed to this fact that the future is not guaranteed and they don't know what that future holds. So we know that mental health is definitely worse than it has been before. It's always been an issue. I would say probably from a positive standpoint, the thing that the pandemic really did that was positive, ironically, is that I think we all suffered a little bit of mental health issues during the pandemic. So now it's not taboo to talk about it. It's not taboo to have these forums. It's not taboo for even you to say, hey, I have family members that directly were affected. And that's okay now. So that's the first step, I think, in this process of moving forward of how do we find solutions to combat this? How do we find solutions? As you know, we've discussed it before. One of my big things is, as a provider, insurance has been near impossible lately with mental health, and it's why we started our foundation. How do we get the access to good care, and how do we get access to funding or access to coverage of that care? And those are going to be our challenges moving forward.
Grace, you have to unmute.
Sorry about that. You would think I would know this by now. Thank you so much for having me on this panel. As Dr. Joshi said, this is an extremely important topic on so many levels, especially for parents who have children who already tend to be more on the quiet side, which I am one of them. And so definitely the pandemic had done a number on all of us. As the CEO of Kenneth Young Center, we do run 35 different programs to ensure much of the services a family needs can be done at Kenneth Young Center. So there's this continuity of services and programmings for the family. We also have a strong relationship with community partners if any referrals are needed. Really, for our services for our youth, as with the rest of our agency, we break it down into 4 major components around prevention, intervention or crisis, treatment, and then recovery. But really, I think for this conversation, what is important to discuss is that first line of defense. It's being proactive. This means prevention programming. And that means like what we tell our kids not to do, right? And to how to stay healthy. But really, for us as an adults, we at Kenneth Young Center are also now offering youth mental health first aid training. This is empowering adults to see youth and recognizing signs of crisis and non-crisis situations and how we handle that. And it's great that Kenneth Young Center is able to offer those services in your district, Congressman, free of charge. So please reach out to Kenneth Young Center for any of those. And thank you for also mentioning that our LGBT Youth and Young Adult Center. This is really a center that was created because the community had spoken. We have a community collaboration that we speak to the youth and to community partners. And what was loud and clear is that we needed somewhere, a safe space for our questioning youth and our youth to have fellowship with peers and welcoming staff to support them. And so I will end my remarks because I could probably talk for another 10 minutes. So thank you again for having me.
Thank you, Grace. Dr. Kasi?
Hi, everyone, and thank you, Congressman, for having me here today. Everyone, I'm Dr. Rekha Kasi, and I'm lucky to work with youth with mental illness. I am a physician who specializes in the psychiatric care of adults, children, and adolescents. My current work is I work at Rush University Medical Center with patients and their families in an outpatient setting. and I am also the psychiatric consultant for our pediatric collaborative care program. The story I hear over and over again is that many patients and their families want help, but they can't get it right away, either due to insurance coverage or wait list issues. And I see the people who have suffered because they've had to wait. And when people have to wait, a lot of times they get worse. And what we see particularly with kids is that kids end up missing school. They might end up in the ER or even the inpatient hospital, when it's something that could potentially be prevented with earlier intervention. And the question is, how can we do better? Some of the programs that are out there, for example, collaborative care programs, which I'm involved with as well, allow psychiatrists to directly consult to primary care clinicians. That way I can give psychiatric level expertise to a primary care doctor, and they can then treat patients in their office and go to the person that they're most likely to go to when there's an issue. I'm very thankful to Congress Krishnamoorthi for being a champion of these causes and for co-sponsoring many of the initiatives that support mental health. Thank you, everyone. Look forward to the discussion.
Thank you, Rekha. Okay, Dr. Smith. You have to unmute. Yep.
Apologies. Took a minute. Hi, good morning, afternoon now to everyone. And thank you, Congressman, for having me to be a part of this panel. Happy to be so. As introduced earlier, I'm Dr. Mashana Smith, and I'm a clinical psychologist with Lurie Children's Hospital and our Department of Psychology, and specifically the Center for Childhood Resilience. Our center is really geared to supporting students' mental health, children and adolescents' mental health, but we do so through a public health lens. As has been stated before, we know that currently children are in a state of what is considered really a national emergency. In 2021, several of the most important entities that speak to children's mental health declared that we were in a state of emergency as it relates to our children. And has been said before, one of the few silver linings that have come out of COVID is our recognition and appreciation for the severity of children's mental health and our need to tend to it. One thing that we've known even prior to COVID is that far too few children receive the mental health support that they need. And of those who do receive it, about 58% receive it in school settings. So schools are incredibly important to ensuring that students receive the mental health support that they need. And a lot of our work is geared towards that. And while we have a great appreciation for supporting school-based mental health professionals who can in turn support the children, due to a number of reasons, we eliminate so many barriers when we offer these mental health services within schools, whether that's financial barriers and not having to worry about insurance, whether that's transportation barriers and not having to worry about that. We just increase access to these mental health services when they're available in schools. So a lot of our work is geared towards that at Lurie Children's Hospital and the Center for Childhood Resilience. The other thing I'll add really quickly is it's not only about treatment, but someone spoke earlier about prevention, and it's incredibly important where kids, youth, spend the majority of their day. And having positive cultures and having positive climates and having climates that are very trauma responsive in terms of their policies and their procedures and those practices within school buildings. So a lot of our work is geared towards that as well. And I'd be happy to speak to that. But I do want to compliment really quickly the Illinois State Board of Education for realizing everything that we're saying here in terms of the importance of addressing and recognizing mental health needs within children. They're doing a great job, and we're happy to be in partnership with them to do that and make sure that we're really servicing 4,000 plus schools across the state of Illinois.
Wonderful. And with that, let me turn to our first questions here from our audience. Let's see. In terms of first question, when we talk about youth with this subject, one of our attendees wants to know, why are we talking about youth and what age ranges or conditions are we talking about in terms of youth? What life phase does it mean when we're saying youth mental health?
Dr. Kasi, would you like to take that?
Oh, I mean, I would generally say, 18 and under, just that under 18 population.
Great.
And
Grace, do you want to say something?
Just real quick, we do have services at Kenneth Young Center because we are state funded that go up to age 21 when they're talking about chronic mental health services for kids on Medicaid. And so we do have a program currently that goes up to the age of 21, but most of our children or services are right around that 12 to 18 when we're talking about mental health prevention programming.
If I can answer that really quickly, we do have an appreciation for the full spectrum. So we're in some alternative schools, for example, where they tap out and transition out at age 21. And then also increasingly, everybody's recognizing the importance of starting during early childhood. So we're talking like 18 months and to 5 years in the early childhood space too. So I think all encompassing.
Will, what's the next question?
Parents, what are the warning signs they should look for with their children in terms of potential mental health issues or similar challenges?
Dr. Joshi?
Yeah, so good question. I mean, we know about some of the obvious warning signs, kids acting out, becoming belligerent, misbehaving, not following directions, getting into bad behaviors, even smoking, vaping, et cetera, et cetera. The problem, and that's a problem. The problem and what we've seen especially in not only our practice, but our community, and I have kids who are in high school and we've seen this even with their friends, it's the silent ones. I think Grace, you'd mentioned that. It's this not just the silent kids, but the ones that are silent about their problems. They don't really act out. They actually just bottle in. Those are the ones that it is near impossible to know when that's coming. And one of the other statistics that you'd mentioned about how many kids have thought about suicide, I did the math, and about 1 out of 5 high schools in America per year will experience an actual suicide. It's nuts, and so that means throughout a 4-year education, almost every high school in America will have a suicide, and those kids will experience that. And a lot of those, people will ask all the time. We've heard it. Oh, what did we do wrong? What did we miss? What signs did we, and people are like, we don't know. We don't know what we would have done differently. Those are some of the most challenging. And I think, to me, the best way to parse that out, so it's almost like what Dr. Smith was talking about. I mean, what resources do we have at the schools? What resources do we have to prevent or to even have even private resources? Sometimes the kids don't want to tell friends or tell people at school or tell their parents. Do we have resources outside of that where the kids can go to? Well, again, the catch-22 there is, even if we did, who's paying for that? If they want more anonymity with that, how are they going to get that? We have a few issues to work through logistically to get the silent kids not only the help they need, but to prevent that from even becoming a problem to begin with. And that's the challenge, right? How do we not just identify, but prevent it? Even go a couple steps back and find out, is the root of this bullying? Is the root of this social media? I think everyone would probably say yes on the call right now. Is the root of this all of the stuff that they're seeing that we weren't exposed to growing up? We kind of had, we had growing up, we knew what was on TV. These guys are exposed to so many thoughts and so many ideas that are just a little bit devilish. How do we work through that? Because the cat's out of the bag with those.
Maybe let me jump in as a follow-up to that. Does anybody else want to speak to this issue of prevention? Because I know that we're going to talk about treatment as well. But does anybody else have any suggestions for prevention? Mashana, do you want to go first and then Grace?
Sure. So in terms of prevention, and some of this, forgive me, I have a couple of things real quick. Someone mentioned their work with youth mental health first aid. I think it's incredibly important for parents and educators to educate themselves about, ways to promote positive mental health. What's important, what the literature has been really consistent is the importance of consistent, healthy relationships with adults. And you'd be amazed at how far that goes. So I will add that as incredibly important. And then in terms of prevention, we always talk about this concept of resilience, which some people love and some people hate. But in terms of how to build that up and kind of build some inner strengths in children, it is important to prevent through, making sure they have strong relationships and connections, making sure they're engaged in different activities where they're able to build their competencies and build some of their strengths and personality that they have. So I would say that, and then also to the degree that we are possible and that we're able to be able to prevent exposure to very toxic situations and stressors. All of that can play a role in terms of prevention.
And to that end, I have something called an act to aid states in creating task forces to combat bullying. You talk about the toxic environments. I got to believe that the rise of bullying, especially on social media, has contributed dramatically to the issues of the youth mental health crisis that we have. And I'm trying to push that. I hope that you folks will mention this as well, both my constituents who are listening in or watching this Zoom, but all of us. We've got to do more on this issue of bullying. Grace and Rekha, do you want to jump in as well?
Yeah, I won't repeat anything that Dr. Smith already said, because that is fabulous. I did see some questions around what is youth mental health first aid. It is for adults, and it trains them to identify, understand, and respond to signs of mental health and substance use challenges that adolescents and youth have. And the focus is ages 12 to 18. And that's where there's just different practices around that.
Got it. Dr. Kasi?
Hi, and I was just going to say, I think it's very important to just be able to intervene early. So that's where some of these programs like collaborative care are really great, because kids are more likely to see their primary care doctor than a psychiatrist. So the people who see the kid the most are the ones who are going to know that there's something wrong. And we need to be able to get those people the help they need to help their children. Got it.
Will?
We have a question about this sort of shortage of resources, which the Congressman spoke to, and a number of our panelists have acknowledged in terms of the need to reach these kids, but the limited resources in terms of trained professionals and others to reach them. Our attendee was wondering if that is tangible in the work you do, and if you're sort of noticing those deficits of resources, those shortages of available personnel and time.
Yeah, I'm going to turn to Dr. Joshi, because I know that he's been talking about the shortage of resources. And I should say in Congress, I'm trying to push for greater resources to train more people to enter this profession of child and adolescent psychology and psychiatry, including immigrants, including others who are trained. But in general, we're seeing just not enough resources in the private sector to deal with these issues. And Dr. Joshi, I know you're passionate about this issue, especially with regard to insurance and other issues too.
Yeah, I mean, and this question, by the way, is you can make a whole hour discussion out of this one question. So there's so many nuanced issues with funding and qualified professionals and stuff. So don't take my answer as a complete answer, but I'll just give you a few nuggets at least, and things that we've seen get significantly worse since the pandemic started. Again, we've been on our practice side, right? So I'm here representing my nonprofit and what we're trying to do to change that funding issue. But on the practice side, I'll tell you what we've seen is we've seen a precipitous change in coverage for patients with all types of pain, physical and mental. Almost everything now is considered medically unnecessary and experimental. And we're talking about services that we've been doing for decades. It's a paradigm shift. It is not a coincidence. And I think it's because 40% of the data says 40% of America needs some type of mental health service. And, if you add that number up, it would be just an astronomical number. And I think it's a business decision. So what we're finding is access. So patients we've been taking care of for years suddenly have no access to us anymore because their insurance, and we're talking about Blue Cross, United, even Medicare, like the big guys, right? They're saying that the services to help them with their something called central sensitization, the centrally mediated pain and or suffering, emotions, anxiety, depression, all of that is not medically necessary. It is a really big issue, and I know that we're seeing this in the practice side. And so, again, we don't have, and that's just part of it, right? We don't have well, one of the solutions we're trying to do is, as a nonprofit, raise money so we can directly vet out quality healthcare facilities and providers and provide fair reimbursement to those providers. Fair reimbursement to reimburse the patient for fair services that the providers are giving. So directly reimburse the patient. The goal is that we can become that insurance company, if you will, the nonprofit, that the insurance companies failed to do. Outside of that, I don't have any wonderful solutions except for compelling, and this is going to be impossible, but compelling those insurance companies to cover mental health services, which I that would be great if you can pull that one off, but I'm not sure that you'll be able to.
Anybody else want to speak to this issue of resources? I think Dr. Kasi, you have your hand up, but I'm not positive if that's from a previous question or this one.
Yes, I would love to answer this. I completely agree with Dr. Joshi. We definitely need to make sure that mental health has parity with medical health, because sometimes it's treated a little bit differently. As I mentioned before, some of the collaborative care programs are great ways to increase access to health. I think we need to increase telehealth access, and in doing so, we may need to improve some of the telehealth laws so that we can serve more people. One thing to consider is adding more residency training slots. Mm-hmm. Illinois is always full, and psychiatry has become so incredibly popular that I have so many medical students interested. There would be people for those slots if they were there. And then, considering doing things to make psychiatric care easier, like streamlining prior authorization. So we're not spending a lot of time on that, and we can work treating people instead of doing paperwork.
Doctors, that's good. I'm actually trying to increase residency slots in psychiatry and other specialties. So this is a good point. Dr. Smith?
Yes, thank you. So the only other thing I'll add is we certainly have a workforce shortage in mental health and community mental health and school-based mental health. So I highly recommend us continue to pursue some of the things that Illinois has begun in terms of workforce training programs, especially to help support students actually make it through the training programs. So the cost that they incur, the student loans that they incur in order to receive the education that's required in order to have a career in this field. I think that's something we need to address. Another thing that we need to address is people like to have, and the research shows, also benefit from having mental health professionals who look like them. And so beginning to, incorporate, have more persons from other marginalized populations, other persons of color who are beginning to provide these supports as well, I think is incredibly critical for us to address.
Thank you, Dr. Smith. What's our next question, Will?
All right, our next question is, what are some of the barriers to community-based collaboratives to increase access to mental health care?
Grace, do you want to take that one?
Can you repeat the question? Because
Sure.
Yes. It's, what are some of the barriers to community-based collaboratives to increase access to mental health care?
I think we just talked about. It with workforce shortage. Really, it's, trying to find the right people. It's not a one size fits all, especially in the behavioral health world. You have to have a connection with the people that you're trying to work with. This is serious stuff that, somebody is trying to share. And if you don't click, and it goes back to what Dr. Smith was saying, if you don't have somebody that looks like you, or, what we've been trying to do is hire more peers to say, hey, you know what, I know what you're going through, and this is what has helped me. But that's also hard, right? Because there's also a lot of things that you need to do to support a peer worker who is in recovery or who is actively in seeking treatment themselves, but wants to give back and get into their own life again. And so I think there's those things. And even though there's a lot of people doing this work, I think there's also a disconnect in terms of who's doing what, and there's an overlap of resources sometimes, and greater conversations amongst, especially our community providers, would be great.
Thank you. Will?
Our next question comes from an attendee who writes, my son regularly uses vapes and pot. He doesn't believe he has a problem, so I don't know how to help him. This has caused negative problems in this young man's life, and school doesn't give information after wellness class in freshman year. The attendee wants to know, as a parent, what can she do to support him in terms of the impacts of the substance use on his mental health?
Well, this is a tough question. I as probably some of you know, I've been on the front lines of fighting the youth vaping epidemic, and we made a lot of progress, especially with regard to e-cigarette makers targeting our youth, namely Juul. And then we went after some disposable e-cigarette makers. The Trump and the Biden administrations have put in new regulations in place. And now, unfortunately, we're seeing a flood of vapes coming from China. And so I'm trying to fight that as well. But this is a more serious question that the person is asking with regard to their own particular child. So who would like to take a crack at that? Dr. Joshi, did you want to say something first?
Sure. If no one else, since there's such a rush for everyone to answer this one, right? This is a tough question. It's a good question. This is kind of alluding to, a little bit of what I was saying before, like, what about the kids who might be showing signs, or the kids who might not be showing signs, or the ones that are just, quite frankly, saying, hey, I don't have any problems, but they may have problems and they're not willing to, and you definitely don't want to just force them into institutionalization. I've just found that it never works in my experience. So how do you sort of, get them there? It might be kind of like what we were talking about before. If we can, this is what we need to work on, having people who are experienced, that kids can maybe even relate to, that can act as a mediator, so they can say, hey, listen, why don't you talk to whoever, at a good influence. And that might end up leading them to finding the right people that they trust. But that's a tough one. I mean, if you're not, and by the way, whoever asked that question is I'm guessing more than welcome to reach out to any of us. I don't want to speak for everyone, but I would imagine more than welcome to speak out to us privately, and we might be able to give some advice privately, because every situation is unique. I think you really do have to look at the parent situation, the home situation, the kid situation, where they live, like geographically, different neighborhoods are different. You have to be respective of that, and sort of the subcultures behind each neighborhood, each city, each school. There's a different way of handling different environments, right? So it is a tough one. I don't have a perfect answer, but I would say that privately, usually, and I'm sure all the panelists here, you're usually able to figure out a solution relative to that individual once you understand that individual's the complete picture.
Grace, did you want to jump in?
Yeah, this is a tough one, I guess. I know for us, when we are asked to come into schools, when the kids are caught vaping, rather than detention or other kind of means of discipline, what we have been doing is using a restorative justice model, where we're kind of turning and saying, okay, well, what's kind of the impetus for the vaping? What's the need? What's the desire, right? Other than the, addiction, is there something else that's kind of causing it? And giving the youth that kind of power of, okay, well, what do you think should happen in this situation? And so it has worked in some cases, and we do a lot of work at the alternative high schools in the area.
This is a tough question. If you'd like to follow up with any of the panelists, please let us know, and perhaps they can even talk to you further about your particular situation as well. Will, do you want to take the next one here?
Absolutely. Our next question from an attendee is, what impact do you think devices, cell phones, and social media are contributing to the mental health decline of our young people?
I think we all have some strong opinions on that. Mashana, do you want to take that one? You're muted. You're on mute.
So sorry about that. I think it's contributing heavily. And to the point that's been made, I think we all think that the Surgeon General has really declared that social media is contributing heavily not only to youth, but to adults' mental health as well. There's so many recommendations. Trying to limit the time that youth are on social media is great. Trying to limit the number of platforms, monitoring their activity is a great idea. Unfortunately, a lot occurs, and a lot of the bullying that was mentioned earlier is taking place not just in physical settings, for example, school, but a lot of bullying is cyberbullying that's occurring over social media. So I would just strongly encourage parents to be as actively involved in their kids' and youth social life as you can, or social media life as you can. It's really important, not only because of what they experience and the way in which it can make them feel emotionally, but the long-term use of that in terms of posting and how the implications that it's having just for their, college career and beyond is huge. So I just can't overstate how much of an influence it's having on all of our mental health during this age.
I was just going to jump in and say, Dr. Kasi, maybe you can tell us your thoughts on this. All of our kids use social media, their devices. I don't know how we can get them away from their cell phones. And a lot of parents obviously are, they might be making a meal in the kitchen and they've got to be able to focus on that. And so they let, the device do a little bit of babysitting for a little while. But we know that some of these devices, and whether it's YouTube or Facebook or what have you, have algorithms that feed not very wholesome content to our young people. What are your strategies for weaning people off devices, if you have any, Dr. Kasi?
Yeah, I think this is a great question. It's really difficult.
You have a 4-year-old. Right?
I have a 4-year-old. His birthday is actually today. I definitely understand this. It's difficult because the second you tell a kid to not do something, that's of course what they're going to want to do. So I think what's interesting is that there's some research into like different types of social media, and the ones where you are interacting with other people and maybe getting feedback can be a little bit more positive, versus the ones where you're maybe more doom scrolling. Those can be a little bit more harmful. So I think it's a really difficult issue because I don't think you can completely get rid of it, but I think at least you could try to limit it and try to direct people to more healthy versions of social media.
Got it. Will.
All right, we're nearing the end. So I think this will have to be the last question. But we have from an attendee, what programs are out there for students who might not be successful in the typical school model, but don't necessarily qualify for extended care programming, therapeutic school days, et cetera? So in terms of a mental health, behavioral health standpoint, what would you suggest for those kids that may sort of fall in the in-between areas?
Interesting. And who would like to take that one? Grace?
So we do have like teen reach programs and after school programs at some of the high schools that we work at. We don't work in every high school in the Congressman's district, but we work at many. We also do other kinds of programming. So the Q Center, if anyone wants to attend, anyone is welcome. We don't ask your name. We don't ask what school. You just kind of have to look like a youth or a young adult. We also do offer other youth-led programming. Now, it might be, for example, from the Elk Grove High School Youth Council. But if it's a kind of a community event, then folks are more than welcome. If somebody is struggling and trying to find kind of that peer relationship, come reach out to us and maybe we can find something in the area that, is applicable. Because again, we are all community providers. And if we don't have something, we could reach out to another social service provider. They might have something. So yeah, be happy to try to coordinate anything like that.
Great. Anybody else would like to jump in?
It's hard to say without having more information, but I just wanted to say I'm more than happy to talk to anyone about a specific situation if they would like after.
Oh, that's great. Jay or Mashana?
No, I would just say the same thing. It is hard without knowing the particulars. Some more information will be helpful. Yeah.
Jay?
Yeah, no, nothing more. I agree with everything so far.
Okay. Well, Will, did you have one more?
Yes, let me pull one more quick one up here. An attendee wonders what our panel thinks are some promising practices for addressing problems in the classroom and how to connect more families to help. What are some of the supports that are already out there that may have the resources they need compared to some of these, but there may just be a shortage of awareness among parents and kids?
Okay, that's a good question. Maybe that's a good one to close on. I'm going to ask each person to give us a little bit of good news, if possible, and kind of some hope for people out there who are looking for some positive messages here. Why don't we start with Dr. Joshi first?
Yeah, so the positive here is that we said in the beginning, one of the good things that has come from the pandemic is that everyone was affected, and now we're able to talk about it. We weren't able to talk about it before. And there are many people within both the healthcare community, the education community, government, parents all over the country who are very cognizant of this problem, both on the left and the right. And so it's a bipartisan issue, which is nice. I know on our end, and there are others like me that are putting a lot of their own resources into figuring out solutions. We're raising money to try to help reimburse patients. We're also raising money to help those patients who've been affected. A lot of mental health happens from some type of trauma, and some of that trauma can be both physical as well as verbal violence, if you will. I call it verbal violence. Bullying, I call it verbal violence. Those things can lead to physical violence and even murder, suicide. I mean, really horrible stuff. Many of those people don't know where to go when those things have happened. They don't know what lawyer to turn to or what law enforcement to turn to. And so our nonprofit's also going to help direct those patients and even help pay for some of those legal costs. These are the kind of new businesses, if you will, or new nonprofits, new entities, new missions, new agendas that are forming post-COVID that would have probably not formed pre-COVID. So out of the dust and out of the rubble, there's going to be new life and new initiatives that I think are going to help many kids moving forward. So I think that's the positive here. The positive is that, maybe this is the worst of it. And hopefully we're going to be all moving in a positive direction from here on out.
Thank you. Dr. Smith?
Yes. So I'll say the positive, and this has just been stated basically, it's just the greater awareness. I don't think there's any going back at this point. We all know the importance of mental health. We all know how widespread mental health problems are, and I think we're in this together to solve them. Literally, there's been billions of dollars spent over the past couple of years with the COVID recovery dollars to support with mental health, particularly in school settings. And so I think this is a great opportunity for advocacy, and we need all of us to be advocating. Parents need to be advocating, school-based mental health professionals, legislators, like we all need to be advocating for continued funds in this space because we can't do the work for free. We need the monies to be invested, but I'm very hopeful that people have seen the benefits that we've been able to gain over the past couple of years by having these dollars invested in this work. And So that is where my hope lies. And I encourage everyone to advocate for your own child as an individual, for any mental health support that they may need. But at a larger level, if you have any capacity, advocate for, ongoing services for all of us, because we need it right now.
Thank you, Dr. Smith. Dr. Kasi, also, is there anything out there that there are already supports, but perhaps there's not enough awareness for usage of that program?
Yeah, I mean, I think there's definitely some things in the pipeline. For example, school-based mental health services and, collaborative care programs. So there's definitely some things in the pipeline. And I think it's fantastic that we're here and meeting to discuss these issues. We know that there are some issues, but we're all here to talk about how to make that better. And I appreciate, you supporting, so many of the things that are, trying to move this forward, like, particularly like HR 2389, the Resident Physician Shortage Act, and HR 5976, the Youth Mental Research Act. I think that's all fantastic, and we have to keep these discussions going.
Thank you, Dr. Grace.
I think it's all about opportunities in terms of who, for me as a community mental health provider and social service provider, it's all about who we can partner with, because we can't do this alone. As Dr. Kashi said, school-based programs, that has had a huge impact. We've made huge strides in the school districts that we as community-based mental health provider is doing in the schools, because school-based counselors are just, not trained necessarily to have a high need child, and nor do they have the time with everything else going on. And so for us, we've seen some really good results and outcomes there. As I talked before, and I think I called it restorative justice, it's actually restorative practices when it comes to working with youth who, again, might not follow the rules, but there might be something else going on. And so to focus on that. And then finally, I'm going to do my final plug for youth mental health first aid training. We've seen, again, great outcomes, and nationally, it's also really showing some good signs. And I'm a big prevention proponent. And so let's start and try to nip it in the bud before it really becomes a crisis.
Are you having a workshop or something in that particular issue?
Yeah, so we do have just general workshops that we do in person, but our folks will also come to you in terms of doing trainings. And starting in January, our folks are getting trained in Spanish. So we're doing Spanish youth mental health first aid training, which will be bilingual as well as bicultural. And so that's just kind of one step, because, it's, again, as I said, it's not a one size fits all. And so to really reach our marginalized communities, we need to make sense of what we're talking about when we're talking about mental health, because we're breaking down the stigma, but it's not in every community. So,
well, I just want to say thank you, first of all, to each and every one of our panelists. I really appreciate your time, but also your commitment to addressing problems of youth mental health. And I just also want to do a couple observations about what you said. One is, as everybody said, the good news is that we're actually talking about this. And that's a big deal, because this is my fourth term in Congress. We have not spent much time on this particular issue during the time I've been in Congress, and really before this time. So that's some bit of good news. The second observation is, as Grace had alluded to, I think we all could use help in identifying or I guess acquiring youth mental health first aid assistance and kind of practices related to that, because we need to be able to recognize it, to be able to deal with it. The third is there's just a lack of resources, and Dr. Joshi, Dr. Smith, Dr. Kasi all alluded to this in different ways, in different settings. And so I'm committed to providing more, and I hope that all of you will continue to advocate for it as well. And then the last observation is, please come to us if you need help. I think each and every one of the people on this panel are helpers. They are people dedicated to helping anyone in the community. So if you come to us and say, hey, I'd like to pursue more assistance with Dr. Kasi or Dr. Smith or Dr. Joshi or Ms. Duffin, I'm sure that they will be willing to assist, and we'll facilitate that as well. So thank you to all of you for your precious time in the middle of the day. And I hope you have a wonderful rest of the day and week. Thank you so much, and happy holidays as well. Thank you.
Thank you. Thanks for having us.
Thank you so much for the panel.
Thank you.
Thank you.